I'm Peter Block in Orlando, Florida with the ACC annual meeting for On the Scene. With me to my left is Sonia Anand from Canada, and she has just presented the COMPASS PAD, Peripheral Arterial Disease Trial. Sonia, tell me about the trial to start with, or tell them about the trial.
Sure.
Shortly, and then we'll talk a little bit about what this means.
Sure. So the COMPASS trial was a large randomized trial in 27,395 patients comparing low-dose rivaroxaban and aspirin in one arm, rivaroxaban alone at low dose in the second arm, to aspirin alone in the third arm. And in that large trial, 7,740 patients had peripheral artery disease, and we've published the results previously showing that rivaroxaban 2.5 twice daily plus aspirin significantly reduces major adverse cardiovascular events as well as major adverse limb events known as MALE. And in today's presentation here at the ACC, I'm showing that impact of rivaroxaban and aspirin in reducing MALE, but also characterizing the prognosis of patients with MALE afterwards. And we show that patients who suffer a MALE have a very adverse prognosis afterwards, with a 200-fold increase in vascular amputations and a 3-fold increase in death.
Okay, so before we go further, just to clarify, you just said suffer a MALE. That may be misinterpreted. And so I want to be sure we deal with that carefully. MALE is major adverse limb events.
Correct.
And those are exactly what, Sonia?
So those are patients with PAD who suffer acute limb ischemia or chronic limb ischemia requiring an intervention. So an operation, thrombolytic therapy, something important, as well as those patients who have major vascular amputation. So if you have any one of those three, acute or chronic limb ischemia or a major vascular amp, you're classified as having a MALE event.
Okay. So we were talking about this earlier. It's an interesting trial, and we'll talk about what it actually means at the end of the day. But it seems to me that, you know, when you look at the trial initially, you say, duh, if you have a major adverse limb event, a MALE, then your prognosis is worse. Well, of course it is.
Yes.
And I guess that's sort of true, isn't it? So tell me what rivaroxaban and aspirin did to that group of patients, because that really is the bottom line.
Yeah. So in the trial, in what we previously published and what we show today, is the rivaroxaban aspirin combo reduces MALE in the order of 45%. And reduces major vascular amputation, so that's above knee or below knee amputation, close to 60%. So that's a large risk reduction in an important outcome, and there are few to no therapies who have shown such a reduction in MALE.
Okay, so let me ask you sort of the final question, the clinical question for the folks out there. If I come to you as my cardiologist and say, you know, I'm having a little bit of trouble with my legs, it hurts when I walk, and you quickly examine me and find out that I do have peripheral vascular disease, should I be on rivaroxaban and aspirin?
That's a good question, and I will say that in COMPASS, our patients, 60% of them had concomitant coronary artery disease. And it's a definite yes in patients who have PAD and CAD. For sure, the rivaroxaban and aspirin combination I would give. It's in the patient who has mild intermittent claudication with a borderline low ABI, who's otherwise completely healthy. That's the group where we could discuss maybe single antiplatelet therapy like clopidogrel or aspirin is enough, but there are many other factors to consider. There are factors such as how well are they treated with statins, ACE and ARB, what is their bleeding risk. Certainly if they're high risk for bleeding or have a previous GI bleed, I'd be worried about the rivaroxaban aspirin combo. So I think there's more debate, discussion needed in that very mild PAD patient without CAD, but the vast majority of PAD patients with concomitant CAD, it's a no-brainer.
Okay. So there's the clinical bottom line here. It also helps to be a good doc to be able to make those decisions for the borderline patients. But for anybody with serious disease, There's no question. This is a good.
Absolutely.
I should point out that 2.5 milligrams of rivaroxaban is not available in the United States. Hopefully soon
That's
will
right.
be, certainly as a consequence of this trial.
That's
Thank
right.
you, Sonia.
Thank you.